everyone, I am Danielle Earl Thompson and I'm excited to share my submission for Laboratory Week assignment in NRSG 748 Advanced Pathophysiology Across the Lifespan. For this project, I chose to focus on a non-communicable disease that I've encountered often in my clinical practice, peptic ulcer disease. In this video, I'll walk you through its pathophysiology, the role of exercise including how I completed a 5K for this assignment, how lab work plays a crucial part in diagnosing and managing the condition, and how we as advanced practice nurses can empower patients towards prevention through whole person care, including faith, lifestyle, and education. Let's jump in. Let me ask you something. Have you ever felt that burning sensation in your stomach and thought, is it just stress or something more? Well, today we're diving into peptic ulcer disease, also known as PUD. But don't worry, this isn't your typical dry lecture. We're going to break it down, connect it to your overall wellness, and even throw in a little spiritual encouragement along the way. So let's get into it. Looking at the pathophysiology of peptic ulcer disease, this happens when the stomach's natural defense is outmatched by the thing that irritate or inflame it, like acid or certain bacteria. Think of it like this. Your stomach lining is your shield, but sometimes that shield gets thin or damaged, leaving your inner tissues exposed. Here are some common culprits. H. pylori infection. This sneaky bacteria weakens your stomach's protective lining and sparks inflammation. NSAIDs. These are medications like ibuprofen, may help with pain, but they also reduce prostaglandins, which normally protect the stomach. Family history and certain demographics can play a role too, especially those from developing countries or African American and Hispanic populations. And of course, there is stress, smoking, alcohol use, and eating spicy foods, lots of it of course, can crank up stomach acid and damage the stomach lining. Over time, that protective layer can't do its job. Acid starts to dig deeper, dig deeper, dig deeper, and the result? Painful ulcers. And H. pylori really doesn't help. It makes it harder for your stomach to even produce bicarbonate, the neutralizer for all that acid. Now, let's take a run into how does running a 5K helps prevent PUD. I know what you might be thinking. How is jogging 5K going to help my stomach? Well, let me tell you something. It does more than you think. For this assignment, I decided to go all in and actually complete a 5K. Yes, me out there running. I'll show you a few clips, but be kind. It wasn't just about logging in the kilometers. It was about connecting the science to real life. And let me tell you, while I may not personally suffer from peptic ulcer disease, I've taken care of many patients who do. And I've seen how lifestyle changes, especially exercise, can make a huge difference in the recovery and prevention. Let's break it down. Regular physical activity like walking, jogging, or running a 5K helps prevent or manage several of the modifiable risk factors associated with peptic ulcer disease. One, there is stress reduction. When we move, we lower cortisol, the stress hormone, and stress is a big contributor to ulcer flare-ups and acid production. Secondly, exercise helps with better circulation. This helps to support good blood flow, supporting the mucosal healing and strengthening our natural defenses. Exercise helps with weight management. Extra weight puts pressure on the abdomen, leading to acid reflux and peptic irritation, both of which can worsen or trigger ulcers. And fourthly, immune boosting. Yes, exercise helps with boosting the immune system. Moderate, consistent exercise improves our immune system's ability to fight off infection, including H. pylori, the bacteria linked to many causes of peptic ulcer disease. So during my 5K run, I reflected on this. I thought about the patients I've cared for, some in obvious pain, clutching their stomach, scared of eating because they fear the burning sensation they would experience or would return. I remember educating one gentleman in particular. He had developed an ulcer after months of using the NSAIDs for chronic back pain. He was skeptical at first, but once I broke it down and helped him to see how exercise, diet changes, and stress control could support his healing, he began to take small steps, literally. As a nurse, those are the moments that stick with me, the ones where science meets compassion and real life impacts. So no, running a 5K won't cure peptic ulcer disease, but it helps lay the foundation for resilience, prevention, and whole body healing. And doing it myself reminds me that I can't just teach this stuff, I have to live it too. Now let's look somewhat into the lab, the God's secret investigator. Yes, let's give some credit where it's due. Labs are the real MVPs when it comes to diagnosing and managing peptic ulcer disease. They're like the detectives working behind the scenes, uncovering clues that helps us to understand what's really going on in the gut. Here's how these quiet heroes do their work. So in testing for H. pylori, whether it's a urea breath test, stool antigen test, or sometimes a blood test, though that mostly works past infections, these tests help to confirm if that pesky bacteria is hanging out where it shouldn't be. Then there is the test for the complete blood count. This checks for like anemia, which could mean there's been slow chronic blood loss. Sometimes ulcers are notorious for this. Then the fecal occult blood test. Not the most glamorous, but this clever test can detect hidden blood in your stool before you ever see it. Looking into serum gastrin levels. If your provider is thinking outside the box and sometimes suspect a rare condition like the Zollinger-Ellison syndrome, this test will help to uncover it.
Legally blonde. Name the 3 possible causes of this patient's hematemesis.
Peptic ulcer disease, esophageal varices, or Zollinger-Ellison syndrome?
And lastly, endoscopy with biopsy. This one, the showstopper. It gives a doctor a direct look into your stomach. Let them see the ulcer, take tissue samples, and even test for H. pylori right then and there. So what's the takeaway? Lab tests aren't just for diagnosis. They help us to confirm the problem, guide treatment, monitor healing, and most importantly, prevent ulcers from making a comeback. In other words, When it comes to PUD, the lab is your gut's best friend. And as an advanced practice nurse, I make sure to use those tools wisely. Let's now dive into how I inspire my patient as an advanced practice nurse. I take a whole person approach to prevention. That means teaching patients in plain language about ulcer risk, especially with everyday meds like NSAIDs, promoting stress relief through walking, prayer, journaling, whatever works for them, encouraging baby steps in physical activity because a 5K can actually start with one small walk, and using motivational interviewing to really listen and help patients find their why for better health. Because prevention isn't about perfection, it's about progress. Now, the whole person's health and our spiritual walk. Let's wrap this up with a reminder from 3 John 1 verse 2. Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers. This verse reminds us that physical health and spiritual health goes hand in hand when we choose nutritious foods, peace instead of pressure, movement instead of sitting still, and rest instead of worry. We're honoring the body God entrusts to us. That's real stewardship. That's whole person care. Now go lace up those sneakers and take care of that temple. Thank you for listening.